Hello, my name is Jamia Young, and I'm here today to talk to parents of students who have been diagnosed with ADHD on the various methods that they can use to help the students learn. I will be talking about the positive and negative effects of both medication and non-medication methods. I think that this is a very important topic to talk about because over the last past 20 years, the ADHD diagnosis has dramatically risen. 10% of kids between the ages of 4 and 17 have been diagnosed with ADHD. Medications for children as young as 3 have been approved by the FDA, and it's been demonstrated that ADHD students can learn at the same pace as their non ADHD classmates if given the right tools. So, what is ADHD? ADHD stands for Attention Deficit Hyperactive Disorder. In 1991, the US Federal Education Department classified this as a learning disability. One of the first people to study ADHD was Sir Alexander Krypton, and he created a lot of the guidelines that are used today to diagnose ADHD. Some of the symptoms a student with ADHD might have is difficulty sustaining attention in a task. They are often easily distracted by external stimuli. They're incapable of attending with consistency to any one object of education. And typically, they have so many thoughts running through their head that they don't really have a clear perception of any of them. Um, Now, when a child or an individual is diagnosed with ADHD, the first method typically use is the medication way. There are two medications that are typically prescribed. These are stimulant and non stimulant. Stimulant medication changes the levels of dopamine and it dramatically raises it. So, somebody with ADHD naturally has low dopamine, which helps you maintain focus. So, medication like Adderall, Concerto, Ritalin will really help your child focus. These drugs are usually the first prescribed because they are 70 to 80% effective for all users. They're fast acting, they take around 30 to 90 minutes to work, and these medications are extended release, meaning that they can last up to 12 hours. The other medication that is prescribed is a non-stimulant, and it works by increasing the amount of neuroamphetamines in the brain, which also helps boost the attention span, and it reduces impulsive behavior and hyperactivities. These drugs include Strattera, Intuvia, and Kappa. These aren't usually the first choice of prescribers because they only work for about 4 to 6 hours, meaning that a user will have to take multiple doses. And it usually takes about 2 to 4 weeks to really feel the effects. So, many ADHD medications either contain acetaminophen or methylphenidates. Acetaminophen produces feelings of euphoria. These drugs are typically habit forming, and there's a tendency for students to misuse them in order to feel happy. Methamphetamines are typically found in the extended release medications like Adderall XL, and they change the chemicals found in the brain naturally. Um, both medications will increase your child's attention, amplify the energy, and lessen appetite and a need for sleep. Long term effects of these drugs include irregular heartbeats, weight loss, psychological problems, increased anxiety, which can lead to depression, which can lead to thoughts of suicide. Short term effects may include sleep problems, growth delays, which usually the growth delays will fix itself over time. It can lead to a lack of motivation, especially when not on the drug. When the drug is getting out of your system, it will lead to irritability, headaches, and fatigue. And because these medication, they become less effective over time as your child's tolerance increases, the dosage will need to be increased, which means the symptoms, especially the short-term symptoms, will restart all over again. Some of the non-medication ways that somebody with ADHD can use are whiteboards or task-oriented apps. Um, Students with ADHD can often forget tasks. So at the beginning of the week, if they write down the task and maybe place it in the room, so when they wake up, they can look at it and say, "Oh, I have this to do today. This is due today." That can greatly help them. Recorders are really, really great for ADHD students because um, focusing in class can be really, really hard. So being able to record a lesson and then play it back later will help them learn at their own pace. Fidget toys and noise reducing headphones are also a great option. Um, Having AD, people, students with ADHD having their hands occupied can actually really help with their focus, and the noise canceling headphones will allow them to maintain their focus even in a noisy environment. These headphones can play, classical music or no music, or even just white noises, but it helps to cancel out those really small noises like the dog barking in the background or the microwave going off, um, so they can really focus on the task. Having a standing desk or having a child having the ability to learn and move is also really great. And having a classroom open space. If the classroom is big enough, uh, when they need to get up and stretch or just pace around, having that in the back of the room can really help. Um, and it also won't disturb other students. In conclusion, ADHD students can learn at the same pace as their non-ADHD counterpoints. Whatever path a parent chooses is fine. It's okay. Um, and it can really help a child. And it's just really important to put the right tools in place to help. So, have a nice day. Bye.